When football great Boomer Esiason's first child was born, he and his wife chose the name Gunnar, Swedish for valiant warrior.
The fact that it means what it does is so appropriate for who he is and what he's dealing with.
Gunnar fights a daily battle with a disease called cystic fibrosis. Find out what causes this illness, how it is treated, and why the Esiasons call their son an inspiration. Right now on Today's Health. This program is brought to you in part by an unrestricted grant from Chiron Corporation.
While many of us take our health for granted, some children are born with a condition that can make each new day seem like a miracle. Hi, I'm Chris Everett, and you're watching Today's Health, where we get right to the heart of matters concerning your health. Cystic fibrosis is a genetic disorder that can make childhood a struggle and often leads to fatal complications right in the prime of life. Today we'll see who's at risk and explore exciting new treatments. But first, it's important to understand the nature of this grave illness.
As an NFL quarterback for 14 years, Boomer Esiason became a pro at defeating rivals on the field. But at home, his family is fighting a different sort of opponent. His son Gunnar was born with a challenging condition known as cystic fibrosis.
You know, like any parent, as soon as you hear something like that, you just have this sick feeling and you immediately become depressed and you think, what did I do to cause this? I mean, you know, it's only human nature to feel that way. Some people carry those feelings on longer than others. I think mine lasted for about a half an hour, and I said, we can't feel sorry for ourselves, and we certainly can't do anything about the situation now as it sits here, and looking back, we can only look forward.
This chronic, progressive, and ultimately fatal genetic disease directly affects the body's mucus production. In healthy people, the mucus produced by the lungs acts as a beneficial lubricant. But in cystic fibrosis patients, that thin and slippery mucus is instead thick and sticky, making breathing and food digestion difficult.
The mucus may fill the airway passages and clog the lungs, creating an ideal breeding area for bacteria. The infections that often follow can be difficult to reach with antibiotics. When the white blood cells that rush to the area to fight the infection eventually break down, they add to the congestion, and the situation steadily worsens.
They'll develop recurrent pneumonias, will affect their pulmonary function and their ability to exercise properly if it gets severe enough. They'll develop wheezing and, of course, infections, which may be manifested by fever. And then they require a whole program or regimen of treatment, which includes IV antibiotics, etc.
Obviously, this is a disease that requires a lot from those who suffer and their families. And since it begins to appear in those who are so young, it's usually their parents who must deal with unanticipated changes to the family routine.
The biggest thing about having a child diagnosed with cystic fibrosis is that your life does change. There's no way around it. I mean, there's responsibilities and diligence that is associated with the therapies that you have to deal with on a daily basis, and compliance of those therapies are the most important thing moving forward. And all of that comes from education and logic and understanding exactly what you're dealing with.